Hello, how have you been? I trust you have been good. Today we have a special tutorial for you, and it is on how to give insulin. Now this video is intended for all parents whose children were recently diagnosed of diabetes, or adults who recently were told by their doctors that they have diabetes and they were prescribed insulin. So we want to educate you on how to give it to yourself safely and effectively. Now, it's important for you to remember that insulin is actually produced by your body. However, when there's an issue with how much is produced, if produced at all, or how the insulin is taken up by your body, then we can prescribe insulin for you to inject. Now, how do you go about that? Let's jump right into it. The materials you need are insulin syringe, wet swab, which is just cotton with a bit of spirit on it, and a sharps box. You can make an improvised one if you don't have one. The example we'll be using today is Insulin. Yours might be Humulin or Novolin R, so just make sure to confirm with your doctor which type you are supposed to use. Before using the insulin for the first time, you are supposed to leave it refrigerated. However, after opening it, you can keep it at room temperature for up to 28 days. Insulin could be a whitish solution. However, other types of insulin like the Humulin R or the Novolin R are supposed to clear. So if you see your Novolin or Humulin R and it is cloudy, or you see that it is whitish, then just take it in your palm, roll it from side to side gently. Notice that you're not supposed to shake it regularly, so just roll from side to side, and then you take it and roll it from top to bottom as well. The next thing is to take off the cap for the plunger and the cap for the needle. So over there is the plunger. That is the needle, which is super thin. The black thing there is the stopper, which the plunger pulls down so that you can get the amount of insulin that you want to administer. Now here's the next thing. Whatever amount of insulin you want to give, we draw that amount of air into the syringe. We're going to push it into the bottle, and it just helps make bringing out that amount of insulin easier. Right after that, you inject the air in the syringe into the bottle while balancing the bottle with the thumb and index finger of your non-dominant hand, so that the bottle doesn't fall over like it almost did here. While holding the bottle, flip it upside down, ensuring that the tip of the needle is totally submerged in the insulin, and withdraw the insulin slowly. We are withdrawing it slowly because we want to avoid air bubbles. Air bubbles will not cause you any harm in this instance. However, it will take up space of the medication you're supposed to get, so we don't want any of that. If you do get air bubbles, inject all of the insulin back and withdraw slowly again until you have no bubbles at all inside of your syringe. And there you have it, 100% insulin, 50 international units. After that, we're going to pick out the site we're going to administer the insulin. For this example, we're using the abdomen. Now the area you're to pick is supposed to be at least 2 finger widths away from the umbilicus, and then you can vary the injection sites clockwise or anti-clockwise, but there should be at least 2 finger width space between each site of injection. Other sites you can use are the fatty sides of the upper arm or the outside of the thighs. As a rule of thumb, the area must have at least half an inch of fat. Next is to clean out the spot you've picked out with wet swab and allow it to dry. Pinch out the area that you want to administer the insulin and keep the needle at a 90 degrees angle, and then you can go in. You're pinching out the fat so that you don't accidentally hit the muzzle. So at 90 degrees to the area of skin you've picked out, you go in slowly, inject all the insulin slowly while holding it pinched. Then you leave the needle there for a few seconds, about 5 seconds, and then you come out. And that's it. Now you can administer insulin safely as a doctor, a nurse, a patient, or as a caring parent. Now remember to alternate the sites of injection each time and to dispose of your sharps safely, either by using a sharps box you can get in a nearby pharmacy or using an improvised plastic container which is sufficiently thick. Now ask your doctor where you can safely dispose of your sharps after the box is full. Thank you so much for watching this. Don't forget to like, to subscribe, or to follow or retweet depending on the platform you are seeing this video. Until next time.